In today's video, we're going to discuss how and when do you enroll in Medicare Part D. So what is Medicare Part D? Medicare Part D is for your prescription drug coverage. And it's very important that you enroll in Medicare Part D on time to avoid any issues and being penalized. Unfortunately, the government wants you to be on a Medicare Part D plan. Now, Medicare Part D is actually optional, which I don't know why it's optional, because if you don't enroll, you get penalized. So it makes no sense that it's optional, but it is optional. But in today's video, we're going to make sure that you enroll and you have no issues whatsoever, okay? So let's start with Medicare Part A and Medicare Part B. So Medicare Part A is your hospital coverage. Usually Medicare Part A is $0 per month. If you worked in the US, 10 years, 40 quarters. So you're good there, right? So Medicare Part A is your hospital coverage. Medicare Part B is your medical coverage. Medicare Part B is important because you want to go to the doctor. It covers doctor visits. It covers labs, x-rays, diagnostic procedures. It covers preventative care. So yeah, Medicare Part B is very important, okay? Ambulance rides, what else? It covers a lot. Clinical research. So yeah, Part B is very important. Okay, so we have Part A and Part B out the way. Now, original Medicare covers 80%, leave you behind 20%. So you can get on a Medicare Advantage plan or you can get on a Medicare supplement plan, right? To help with that 20%. But this video is not about that. It's about Medicare Part D. So Medicare Part D is for prescription drug coverage. This is very important because a lot of individuals is like, I don't take any medications, so I don't need a Part D plan. You're wrong, okay? So there's other credible coverage that is fine, and that means that you don't have to enroll in Medicare Part D, and that is if you have employer's coverage, if you have VA, you have TRICARE, that is fine. You don't need a Medicare Part D plan, which is prescription drug coverage. As long as your employer is covering you, they have, great coverage and all that is credible coverage according to Medicare and is covering your medications, then you're fine, right? However, if you're turning 65, you have a 7-month window to enroll in Medicare Part D, okay? You have your 65th birthday month. You have 3 months before you turn 65, and you have 3 months after you turn 65 to enroll in a drug plan. There's 2 ways to enroll in a drug plan, which is Part D. You can enroll via a standalone drug plan, meaning you have a Medicare supplement. Because the Medicare supplement does not include drug coverage, you need a standalone drug plan, meaning that that plan only covers prescription medications, right? Or you could get on a Part D plan by enrolling in a Medicare Advantage plan, okay? So you get on the Medicare Advantage plan that includes prescription drug coverage. And that's how you enroll in a Part D plan. Because Part A and B, you enroll through the Social Security office, right? But when it comes to Part D, you have to enroll in that on your own. Like I said, standalone plan or a Medicare Advantage plan. And our office can help you with that as well. Just to let you know, FYI there, okay? So let's talk about the ways that you can enroll in a Part D plan. You could go on Medicare.gov and research the plans in your area, put in your zip code, put in your medications, and it will spit out the plans that will work for your situation. You want to look at the medications tiers, you want to look at the cost of your medications, co-pays, and all of that. You could just go on there, pick a plan, and you have your Medicare Part D drug plan. You could also call 1-800-MEDICARE directly. You can call Medicare and they will walk you through it. They will help you enroll in a drug plan as well. Another thing you could do, you could call the insurance companies directly. You may want to call more than one to make sure that you're getting all the coverage, because every plan covers different medications differently. Like some insurance company may cover Eliquis, some may not, you know what I'm saying? So it depends on the tier of the medication. So it really depends on the medications you're on and the insurance company's formulary, okay? So it doesn't mean that all of these insurance companies is going to cover your particular medications, okay? So the fourth option is to work with a broker like my agency. And working with a broker to me is the best option. I'm not saying this because I'm a broker and I'm trying to sell myself here. No, it's really nice to work with a broker that could support you throughout your lifetime, throughout the time that you're with them, right? As long as you have a policy with them, they should be supporting you. They should be giving you customer support. That's what our agency does, right? We provide customer support for our clients. If you have questions, concerns, you want to look at your plans for the next year, we are there for you. We will help you with all of that. We will help you navigate all of that and help you get on a plan that is best for your particular needs and the medications that you are taking, right? So even if it's with not my company, I definitely recommend that you work with an independent broker, okay? Now, when it comes to a drug plan, a standalone drug plan specifically, a lot of brokers would not work with you. They don't want to service clients just for a drug plan. However, our company will work with you if you have a Medicare supplement plan with us. And of course, if you have a Medicare Advantage plan with us, we will definitely work with you and help you navigate your medications year after year and making sure that you're on the plan that best fits your needs and that's helping you with the costs as well, because that's very important because a lot of these medications can cost a lot of dollars, right? A lot of these medications can be very expensive. That's because the US government don't really negotiate drug prices. So that's why the medications here in the US is very expensive. So it is very important to work with a broker that's on your side that will help you navigate the costs and such. Now, let's talk about an individual that does not take any medications. You're like, Patricia, I don't take any medications, but remember, you don't want to get penalized. So it's very important to enroll in a drug plan, even if you're not taking any medications. There are plans out there that is very low cost or even $0 per month. If you're not taking any medications, we will recommend you to go ahead and enroll in a plan like that. So that way you satisfy CMS, Center for Medicare and Medicaid. You don't have to worry about being penalized and such. Let's talk about being penalized, okay? So if you decide not to enroll in a drug plan, right? No one is monitoring you. No one's going to send you a letter. No one's going to say, hey, you didn't enroll in a drug plan. But what happened is 10 years later, you're 75. You need to be on a medication, right? Now, when you do go and enroll in a drug plan, that's when you get that ding. You did not enroll in a drug plan in the past 10 years, so we're going to penalize you. And unfortunately, it's not like it's a one fee, okay, here's a check. No, you're penalized for the remaining of your life. You have to pay an additional premium for every month that you went without coverage. You have to pay a certain amount and you have to pay that for the rest of your life every single month until you're no longer on a drug plan. You don't want to do that. You don't want to do that. I would just be so jaded if that happened to me. So that's why I'm making this video, to let you guys know that yes, you definitely want to enroll in a drug plan. Like I said, you have a 7-month window to do so. Now, let's say you miss your 7-month window. You're watching this video and you're like, I never enrolled. I never enrolled, right? So there is special reasons why you can enroll. Say if you're just moving into a new area during the open enrollment period, which is October 15th to December 7th. That's the annual enrollment period where you could go ahead and look at drug plans and go ahead and enroll. It's just better to just go ahead and enroll as soon as you can, so that way you don't have to worry about, just year after year. All you're doing is having that penalty grow more and more and more. It's better to just enroll as soon as you can versus letting your penalty just grow year after year, because it would just grow year after year. Unfortunately, that's just the way it is. So it's very important to go ahead and enroll in the drug plan as soon as you can. Of course, the best scenario is to enroll in one when you first turn 65. Okay, so I hope I made it super clear on when you need to enroll in a Medicare Part D drug plan. If you have any questions, concerns, definitely leave them in the comment section below. If you need any assistance, we'll be more than happy to assist you. We never charge for our services. If you know anyone that needs this information, definitely share this video with a friend. And if you're not subscribed, subscribe to the channel. I would love to have you here. Thank you so much for watching, and I'll see you on the next video. Bye.